Now let's move on to MVPs. You're our resident expert on that as well. So, what are the most important couple of changes you see in MIPS value pathways for 2024?
Yeah, great question. CMS has done a really good job investing in MVPs as a pathway through reporting. They have added five new MVPs, which makes MVPs accessible to more specialties and more practices. If you recall, in 2023, we had 11 MVPs. Those all still stand. So we are up to a total of 16 now. But the 11 that were in place in 2023 have had some changes. So it's really important, just like we talked about in quality, to review the specifications, look closely at what the different MVPs are including. Measures have changed a bit over the year.
Thank you. And what are the five new MVPs?
Yeah, so we have focusing on women's health, quality care for treatment of ENT disorders, prevention and treatment of infectious disease, including Hep C and HIV, quality care for mental health and substance use disorders, and musculoskeletal care and rehab support. So a wide array of different specialties, and hopefully that combined with the 11 MVPs that have been in play, there is an MVP for lots of different practices, and it's worth exploring.
Great, thank you. Now, there's a cost category in MVPs. How does that differ from cost in traditional MIPS?
Yeah, that's a great question. So, in traditional MIPS for cost, you practice, however, you're submitting a practice or an individual could get scored on any number of cost measures. And it depends on how CMS determines the practice to have eligible patients for each different cost measure. There are I think 25 cost measures out there. So it can be a little bit hard for a practice to know if they're going to be subject to this cost measure or that cost measure, et cetera. With MVP, you get a smaller subset of cost measures. So if you have patients or encounters that are eligible for that smaller list of cost measures, then cost may apply to you. But if you don't have patients who are subject to cost for those particular measures, cost doesn't apply to you. Really, using an MVP in the cost category can be a way to limit the amount of cost measures that may apply to your practice. And that could be a good scoring strategy for some folks.
Well, thanks, Bridget. That sounds like good advice. Now, how do improvement activities fit into MVPs?
Improvement activities in MVPs work similar to how they work in traditional MIPS. The group or subgroup or individual chooses the improvement activities they want to report. The difference is in an MVP, each MVP has a list of specific improvement activities that are available for selection, and you're not able to select improvement activities that haven't been made part of that particular MVP. This could be burdensome, but IA, that is to say, improvement activities, all those points are doubled when you report as an MVP. So you may only have to do half as many activities as you would through traditional MIPS. So there are some benefits in there as well. There also is a new improvement activity related to participating in an MVP. So that might be worth exploring.
Great. That's very interesting. Now, Bridget, has CMS defined yet the date that they plan to sunset traditional MIPS and fully adopt the MVPs?
They haven't, Dan. They have in previous years made some predictions. We have seen no further detail on that. I think we have a long way to go before sunsetting traditional MIPS and fully adopting MVP would be a viable option. But certainly, we pay attention to everything CMS says and really look into that information so we can share it with our clients. At the moment, we have no further information and nothing to indicate that that's going to be happening anytime soon.